Um, my name is Steve Nish, and I work with LA Best Babies Network, and I'm on the communications team along with Amie and Helen. You'll be hearing from Amie and Helen a little bit later. At LA Best Babies Network, we work to manage the consortium of home visiting programs, and we kind of coordinate and oversee and support a whole network of home visiting programs throughout the county. I'll say a little bit more. I guess that we have a slide about who we are and what we do real quick, but just to say kind of like what we're going to do here in this webinar, what the plan is. We're going to just talk about these free resources that we mentioned. They're available through home visiting programs in LA County. And we've got a newly enhanced tool to make it really easy to find what's available locally for you. All programs are free and they're voluntary. And we're going to hear from Connie at First 5 LA, who is an expert on home visiting and also works as a program officer at First 5 LA. And she's going to give a kind of quick overview about these programs, what they are, and then we're going to go through how you find them. But actually, before we do that, we're going to talk to a mom who's involved in a home visiting program right now. She's going to share her experience real quick, and then we're going to zip through the demo of the eDirectory to help you find these programs. And then I'm hoping we'll have a little bit of time for questions at the end. So if we can't get to your question, you can type a question in the chat. If we can't get to it as we go, we will try to make some time at the end for questions. So, all right. Oh yeah, on the next slide, I think I've already kind of covered what we're going for here, just answering these questions all about home visiting and the great benefits that they provide. And to give that overview, I'm going to turn it over to Connie.
Thank you so much, Steve, for the opportunity to be here with all of you. And thank you for joining us. So this is very exciting. We're going to take you along a home visiting journey, starting with answering the question, what is home visiting? So home visiting is a service. It is a service that is voluntary and at no cost for pregnant people and because it could be both, families that have young children, so children birth to 5 years old. The services themselves are depending on the actual program selected, can vary in length, but generally they provide services that are personalized to what it is the family is needing at the time. I want to add that they're also strength-based. So they really look at what the family has that's really serving them, that's really helping push them forward, and works in highlighting and using those strengths in order to address, some of the needs that the family identifies. Another piece of home visiting is that it connects families to community resources and services. So for example, when a home visitor goes out into the home, if the caregiver shares that maybe there's a need for, let's say, food, the home visitor will share with them local resources that they can reach out in order to connect to that service. Next slide, please. So what are some differences? So as I mentioned, there are some, depending on the model, the home visiting model, there are some slight differences in terms of what it is that home visiting looks like. So first, the type of individual that goes out into the home. Some models, it's a nurse that goes out to the home. Other models, it's an individual that may refer to themselves as a family support specialist or may refer to themselves as a home visitor. At the end of the day, what they're there to do is to provide with the family support. They also provide curriculum. And so what does that mean? Curriculum is information that these home visitors are fully trained in order to support addressing needs that the family may bring up. An example is child development. There may be a family that might want to know more about their baby's growth and what are some things to expect so that they can prepare. The curriculums that these home visitation programs have will help support the home visitor in sharing information that's up to date and developmentally appropriate, to where the child is at. If the caregiver is pregnant, there are curriculums that also support providing information to support a healthy pregnancy. Other things that home visitation programs provide, backtrack. So some of the other differences is that these home visiting programs may have different eligibility. And the eligibility is based off of the model, but also funding. So who it is that provides these models, the funds to actually go out and see families. The great thing, if you're wondering, where do I find out this information about eligibility, is that Steve and the LABBN team will guide you through the eDirectory that can kind of help, not make that as complicated. It really simplifies it, so that's something that you don't have to really be concerned about. Other differences is how the program is delivered. There are some home visitation programs that are solely virtual. There are others that are hybrid. And then there are those that are strictly, face-to-face. And something that is, worth asking, when you are encountering someone from a home visitation program, is asking them and seeing if it's a great fit for the family that is requesting home visitation. Or if you are a family member that is interested, asking what fits you. And lastly, in terms of differences, it's the duration. So I alluded to that in the first slide, where depending on the model, sometimes it could be an interaction that's up to 9 months. Sometimes it could be up to 5 years. And so what's important to know when you are looking at a home visitation program is seeing, what is the best fit for your family, or if you're a professional looking to link a family, knowing what the family has communicated in regards to, what works for them, and finding a home visitation model that meets that. Next one, please. So why are these services at no cost? Why are they free? So home visiting providers, they receive federal, state, and local funding so that they can provide these services to the community. And so, again, this funding dictates some of, who can actually access a specific home visitation programs. Next one, please. And who can participate? So, as mentioned earlier at the start, absolutely pregnant peoples, first-time parents, caregivers. And by caregivers, it doesn't necessarily have to be biological. It could be kinship, or it could be a grandparent, an auntie, a relative. Fathers, absolutely, and families with older children. So it's not necessarily sometimes when people think of home visitation, they think it's just for families that have babies, but that's not the case. It's definitely open to children 0 to 5, as mentioned earlier. Next one, please. In terms of the programs that are in the eDirectory, we have various programs noted. And again, this is something, and Steve can correct me if I'm wrong, but I have a feeling that I'm about 99% sure on this one, is that the eDirectory is living. And so as we get more information in regards to new programs, they are included in the eDirectory. And as funding shifts and changes, because we know that's common, the edits are made to the eDirectory so that when you're accessing the information, you can trust that it is done, that what you're receiving is as accurate as possible. And so some of the models that are noted here are Early Head Start. We have Early Steps to School Success, Healthy Families America, also known as HFA, Healthy Start, Nurse Family Partnership, also known as NFP, Parents as Teachers, known as PAT, Partnership for Families, which is PFF, Raising Baby, and Welcome Baby. Additionally, you'll also find information in regards to doula programs. And so those doula programs that are included are the AIM doula program, I apologize. My view right now is itty bitty. So let me make this a little bit frontline doulas. And the last one is SBCC Thrive Doulas. Next one, please. And now we will transition over to sharing, as Steve noted, having someone who's actually, went through the program. So this is very exciting. All yours, Steve.
Thank you so much, Connie. Yes, I agree. It is very exciting. It's great always when we get to talk to those who are involved in the programs, because that's really what it's all about. It's really just about supporting these families. And so always great to hear from them firsthand. I know there are a lot of providers here, and I was really excited to see the registration list of just a great diverse array of folks from community clinics, CPSP folks, WIC, other service providers in the housing, and all over the map, which is fantastic. We wanted to expand and sort of get out beyond our own network, so we're not just preaching to the choir here. So thank you so much for joining. If you're somebody who might be able to refer a family to help a family, this is how you do it, and this is why you do it. So we're going to talk to a mom. One other thing I neglected to mention at the beginning is that we have a raffle coming up at the end, and it's for some baby items. If you are a provider and you don't necessarily need those yourself, regifting is totally fine. So you can use those at your clinic or for some of the families that you serve. So the raffle is to come. But now I'd like to introduce Deborah, who is a participant in the Welcome Baby program at St. Mary Medical Center in Long Beach. And she is not a first-time mom, but a new mom. She just recently gave birth and is in the Welcome Baby program. Just recently had a visit, her, I think, 2 to 4 week visit. So she's got her hands full, and we owe her a huge debt of gratitude for joining us today. So Deborah, are you there?
Yes, I'm here. Can you guys hear me?
Yes. Great.
Okay, perfect. Hi. So yes, my name is Deborah, and I absolutely love the Welcome Baby program. They provided me with this book here. Unfortunately, my daughter ripped it, so sorry about that. But I do have this as well, which is awesome. Great information on just everything. When the child is sick. This book is so easy to read, which I love because it's so thick. The Welcome Baby program has really supported me with a lot of information and resources. Again, I'm not a first-time mom. I actually am a mom of 3. I have a 6-year-old, a 6-year-old, 21 month or 22 months, and a 1-month-old. And I do have my hands full, but and then in the midst of all this, I was moving. I'm going through a lot of I'm actually going through something right now, which is personal, which I won't get into, but and then with our truck broken down during the move, having Ms. Lee, which is one of the parent coach, she's been great, very supportive. She is very resourceful, and it's just really easy to talk to, which made me very comfortable. What else? I mean, there was so much information that was given, whether it's breastfeeding, home safety, how to just everything in general, which I couldn't be happier, because even though, yes, I'm not a first-time mom, sometimes we forget, or sometimes we just need reminders, or we need more information. And it's only been helpful to me. So, and then, just taking care of myself, she did really, help support me in that aspect where, in order for me to take care of my kids, I definitely need to take care of myself as well. And then, again, like with 3 kids, it's definitely a handful. So I couldn't be happier to be part of this Welcome Baby program. Yeah.
Thank you, Deborah. Yeah, that's so great to hear. I know you had I think you were a little bit hesitant at first when, about the idea of somebody sort of coming to your house and so on. And I know it's a very common feeling that people have, or sometimes a little apprehensive about that. I don't know. Can you share how that's gone for you? What the experience has been like of actually having somebody come to see you?
Oh yeah. I mean, again, I was personally going through a lot, and I just, in the beginning, I was like, oh my gosh, one more person to come to the house, so it really was, wasn't like up for it. But then I was like, again, Miss Lee is very easy to talk to, so I welcomed her into my home, and it was actually a really good experience. It again, it just helped me feel more relieved that someone like her can come in and actually make me feel that way. Just because, uh, you know, like with my partner going to work, and then I have lots of things, going around in the house. When she did a walkthrough, and, she kind of helped me out by like, oh, she made suggestions like, oh, this is what you can do, or, this is what I would do basically. And, it's, I'm open to those, recommendations. So, it was really nice. My experience with, in-home visit was, it was great. It was not bad at all. So, if you guys can have Miss Lee, that she would be great for you guys.
That's great. Yeah, that's nice. And it's nice to hear you say how she makes suggestions and so on. I know that home visitors often talk about how important it is not to judge families. They're not there to come and, see what you're doing wrong and to make sure you're corrected and that sort of thing. It's really about finding like what strengths you have and expanding on those and trying to emphasize.
Yeah.
Sometimes I hear from parents, they say it's like, they just felt so comforted to hear that you're doing okay, you're doing the right thing, and don't worry about it. So
yeah, when I gave birth with Alexander at 35 weeks, and he was diagnosed with a little bit of jaundice. So I've been, watching out for that, feeding as much as I could, and she was helping me reassure that, one of the things I needed to do, as well as this book too, which is great. So yeah.
that's great. Yeah, I mean, looking back on maybe your previous kids, can you see how things might have been different if you had a program like this? I think you had said this is the first time you found out about home visiting programs was just with this baby now. I don't know, any thoughts you might have on how things would have been different if you had this earlier?
Well, I mean, I definitely, if I had that support in the beginning, I mean, not that, again, even as today, with a mom of three, I'm still learning. I have to be honest. Like, I mean, it's because every child is different. But yes, if I were to have that welcome baby program, with my first, I think it would be, I wouldn't say it'd be different, but my experience still was great. But I guess it would have been better for sure, because this, like I said, the information and the resources that they have provided me has been nothing but helpful. Yeah.
Great. All right. Well, yeah, so glad to hear that. I don't know if we might have time. I know I said questions at the end, but we might have time if anybody has any questions. I don't need to be the only one asking them. If anyone else has something they want to put to Deborah about her experience, you can just unmute if you want, or you can put it in the chat.
I had a quick question. How long do these visits typically go for at your home? Or does it depend on the reason for visiting or what stage they go to your house?
Is that a question for? I think that would be. Well, I've already had 2 in-home visits, but I'm not quite sure how many more visits I would have. I think maybe, from my understanding, I probably would have 1 more visit.
Oh, okay, thank you. As in regards of like duration, I mean, like, is it like an hour long, 30 minutes that they're usually there at your home, like to assist you and provide you with information?
With Miss Lee, her home visit with me was, I would say, between like half an hour to an hour, but I mean, it just all depends on how much questions you have. Again, she made it really easy for me to talk to her. So I think my in-home visit was probably longer than what anybody else would expect. But she was great though. So I really enjoyed just talking to her. I mean, in general too, because again, I had some personal issues that I was dealing with, and she really helped me reassure myself, which was just amazing because I needed that emotional support. You know,
Mm-hmm. Oh,
being the circumstances that I was in, yeah. So, um,
okay. Thank you for that, Deborah.
of course, yeah, of
It's
course.
amazing.
Yeah, that's a great question. And then just to the point about how long the programs can last, the Welcome Baby program is what is considered a little bit more of a light touch program. So it doesn't go into doesn't go quite as far. It's available during pregnancy and then for 9 months after. But like Healthy Families America or Parents as Teachers program sometimes can go till the child is in kindergarten. So they can last quite a while and have more frequent visits. Like Deborah said, it does depend on your circumstances and your desire too. I mean, there's a lot of flexibility for parents. They're not locked into something here when they sign up. So, but yeah, there's some diversity in terms of how the visits go, how often they are, and as far as visits, we mentioned visits in the home. There's flexibility in terms of where the visits can take place too. If if a family isn't comfortable having someone come to their house, they can meet at a park or meet somewhere close by. Some of the home visiting agencies have a place there at their office that they can meet or whatever. So they make it work.
Yeah, even my partner, he looked at this book. He was like, "This book is amazing," and he was really happy that we have something like this because he definitely needs it. So
That's great. Yeah, and thank you for mentioning your partner too. It's not, program. These are not just for moms. I want to emphasize as a dad too. I want to, advocate for dads.
yeah.
They definitely need help too, and so these programs are certainly not just for mom and baby. They're really for the whole family.
I just want to step in into this conversation a little bit. I'm Mrs. Lee. I'm Secretary Lee here at Families in Good Health at St. Mary Medical Center Welcome Baby Program. I'm a parent coach supervisor, and Barbara is such a great, person to work with. And when she mentioned about partners, yes, her partner was involved her husband was involved in this visit as well. So it's not just for her, but for both of them. And so from my own words, it's will be different, but maybe you can hear from Barbara how is her partner, feeling, or how he's comfortable or question, or any engagement in this. Maybe Barbara can share a little bit. Barbara, Deborah, I'm so sorry, Deborah.
It's okay, don't worry. I get that sometimes, yeah. But I get Barbara or Brenda. But anyways, yeah, no, he was definitely apprehensive at first as well. Just the same way in the beginning we're like, oh my God, another home visitor. But yeah, again with Miss Lee making it so comfortable, she answered or she helped answered and just made us feel more relieved with the information that she was able to provide us. I'm telling you, my experience may be different from others, but I had a wonderful experience, and he has nothing good to say about this program and this lead too. So, yeah, I mean, I think everyone should try it for sure if they have the opportunity.
Yes, I want to say that the Deborah partners was involved in this visit, and that's what Steve mentions, that we want to have father engage in the visit. So it just like very fortunately that the FOB was there to to engage in the visit. Because I just want to share a little bit of the backstory, because somehow the intake was that phone number was mistyped, so so I cannot reach her. So, and this is a other visits in parent coach supporting the in lieu of RN, because we lack of RN here. We have only one RN. So parent coach is trying to reach out to client when clients is getting when client got out from the hospital. So parent coach is reaching out to do this first 3 to 5 days 72 hours visit with clients to help support client and baby, to ensure baby is healthy, and of course jaundice and also feeding is very important. So we want to help support mom and babies in this. And I could not reach her, and I was kind of like like feel kind of like sad knowing that the baby was born premature at 35 weeks. So I feel like, oh, I want to reach her. I want to reach her so much, but the phone number is not working. And it's the only phone number that is in the file. So I'm reaching out to the hospital liaison to see if any other number in the chat. So, finally, I was able to get the phone number. So, with, a lot of like convention, like, about the phone number. So anyway, I try to reach out with this phone number. So, and then of course, Barbara's husband answered the phone, and I was like kind of a little easy and soft touch to him a little bit, that is it the right number for is Barbara, that I would like to speak to her. So, and he was very helpful. He was like, yeah, she's here, you want to talk to her. It's very I just feel like so happy that he just like I feel like he's kind to me by like like say, hey, you want to talk to her? Yes, she's here, instead of like asking me so much question, why you calling, what you calling for, and who's this and who's that, so and I make appointment right away, and I offer like, can I visit them, because it's been 5 days already. The baby was home, and the baby age is 5 days. So I just want to get to see Deborah and her baby and her family. So she says, sure, you can come down. So I just fly right there, not on the plane, but on my car. But I just go as, right, drop everything and just go to visit her and trying to support her, because my main concern was the baby was, premature and 35 weeks, and baby not even in the NICU. That was my concern. Usually, like baby, has a history, spend a few days or something in the NICU, but it wasn't. So overall, I have a lot of things like in my mind, like to see if I like baby is okay. That's my main concern. Yeah.
Well, thank you for your persistence, Sitari. Yeah, thank you for making it happen. I know we hear from home visitors who often they have trouble making connections for parents to sorry about that. There's a phone call. I don't want to talk to anybody. Yeah, we have, I was going to say, heard lots of times some of the services that home visitors provide are really to make those connections with other services and other benefits throughout the county. And I know they often have to be very persistent in just getting through on the phone and making sure that they can get get what their families are looking for and what they need. So anyway, thank you for your persistence, Sitari. I know we do have, let's see, a couple questions in the chat real quick. Let me just get to those. Do you prefer in-person visits or telehealth visits? I think obviously it's, it's going to vary for families, but during the pandemic, the home visiting programs really did step up, and we're able to deliver great services via telehealth and virtual visits. But there are some things that I think, we found that just work better in person, trying to provide breastfeeding support or trying to conduct child development screenings, or even the screenings for parents, emotional, mental health screenings and so on. It's just, I think really ideal if it can be in person. So, and then Karen, your question, may you expand on the different ways that these programs can reach out to potential clients? Amy's going to get into the referral process a little bit more, but on the referral forms, they do have a spot where you can indicate, if you prefer to be contacted by text or email or phone or whatever. So again, always trying to keep the families first and meet them where they are and how they want to be met. All right. I am going to turn it over to Amie. Let me just thank you again, Deborah. Thank you, Sithari, too, for chiming in. Really appreciate your joining us, Deborah, making time for this. I know, as I said, as a new mom, it's not easy, but what a trooper you are to join us. Thank you.
Of course, no worries. I appreciate you guys having me. Thank you.
Thank you.
Thank you, Deborah. Thank you so much for being here. Thank you.
Of course. Thank you, Ms. Lee.
All right, I'm going to turn it over to Amie now. We're going to get into the actual tool for helping folks, either whether they're providers or whether they're families seeking these kinds of services. Yours, Amie.
Thank you so much, Stephen. A big thank you again, Deborah, for sharing your experience, and Ms. Lee also for joining us here today to talk a little bit about your perspective too as a home visitor supporting this family. So I'm really glad that we've had a chance up until this point here on today's webinar to get a nice overview, a quick overview about what home visiting is, some of the similarities between programs that you may find, also some of the differences. And then, like I mentioned, just hear from Deborah, a home visiting client herself, about her experience in just one of the home visiting programs within LA County available to pregnant people and families with young children. So you may have noticed that we haven't really gotten into the specifics about eligibility requirements and all the different things that would make somebody eligible for the programs. And that's kind of by design, only because there, as you saw on the slide that Connie mentioned, there are 9 different home visiting program models in LA County and 3 different doula services that are in the eDirectory, and they all have different eligibility requirements, not only as a program, but as Connie mentioned, by funding source. So that can start to get complicated really easily, right? And so what we realized was that was the case. And so the Los Angeles County Early Childhood and Home Visitation Consortium put together this eDirectory, which is what we're going to get into for a large part of the rest of today's webinar, just navigating the tool, letting you know how you can use it to really make that connection between identifying what home visiting services and doula programs are available for somebody, and how to make that connection to those specific programs once you've identified a good fit. So let's go ahead and jump into just a quick overview of the eDirectory. So what is the eDirectory? I've touched on this a little bit, and it's been touched on throughout today. It's an online tool that helps connect those who are pregnant or who have young children, as Connie mentioned, between ages 0 to 5, with free home visiting and doula services in LA County. So who can use it? Anyone who's on this webinar today can use it, whether you fall into the families category or the health and services provider. The system has 2 different pathways, which we'll go over in just a moment. That makes it easy for you to navigate based on who you are and how you plan to use this tool to find out about home visiting in the county. How many programs? So we've mentioned that there are 9 different home visiting program models and 3 doula programs. And altogether, there are about 35 plus community organizations and hospitals in the county that are using those models to provide home visiting services to families. And so how do we know which programs are available? All you're going to need to do if you're using this tool is just answer a few questions about the person you're referring. And the eDirectory is going to take all of that information to sort out eligibility and show all available programs for that specific person. So let's go ahead and jump into it. I'm going to go ahead and change my screen here and get to the actual home visiting eDirectory website. So how do you navigate to this tool? You're going to need to go on a browser and type in eDirectory.homevisitingla.org, as you see here up at the top of my screen. And once you're here, you're going to get to this landing page. And this is really where you would start a search for home visiting programs. But before we get to that, I want to go ahead and show you all just some, or draw your attention to some of the other pages that exist on this website. So if you want to learn a little bit more about the eDirectory, who funds it, who manages it, and how it came to be, you could go ahead and visit this tab under the About. You would select this eDirectory to get more information, or you could go ahead and also select home visiting. What is it? To learn a little bit more about home visiting. Like I said, I know we touched on home visiting and just got into that briefly, but if you want to know a little bit more or get more information, this would be a good start or a good place to start. We also have frequently asked questions. So there are often questions that people have about home visiting or even about using the eDirectory that we hear. And so we put this page together, or this section together, to help navigate through some of those questions. So here are some of the questions, and then you just need to toggle down or up to be able to find the responses.
Amie, I'm so sorry to interrupt you. I think it might be on like another monitor of yours. We're still looking at the demo slide.
Okay, let's see here.
Sorry.
Let me go ahead and stop my share and I will start again. Thanks, Steve. I appreciate it. Sorry about that. Okay, can you all see my screen now?
Perfect. There it is. Yeah, thank you.
So let me go ahead and go back to the beginning here. I apologize. So to navigate to the home visiting eDirectory, you're going to want to go on a browser, search eDirectory.homevisitingla.org, as you can see here at the top of my screen. Once you're there, you're going to see this screen that's showing up on my end. And you would start a search for home visiting programs here on this page. But before we get to that, like I mentioned, I was just covering some of the different pages available and other resources available on this website. So the About tab will share a little bit more about the eDirectory. The tab where we list home visiting, what is it? It's a good place for you to go to learn a little bit more about home visiting. I know we touched on it briefly here, but if you want to get just a little bit more information, this might be a good place to go. The FAQs page shares a little bit about some of the frequently asked questions that we hear when it comes down to people getting familiar with home visiting and maybe learning more about them. So all you'll need to do is go ahead and use these toggle buttons once you get to the section on the website to learn a little bit more and see the responses for each of these questions. And then we also have a page that lists all of the programs. So as you see here, this section has the home visiting program models, which Connie covered earlier in today's presentation. And then there's also information about the doula programs. Down below, we list all of the different agencies, whether that be a community-based organization or a hospital that provide these programs or home visiting program models and doula programs. So again, just wanted to go ahead and draw your attention to these pages, and I invite you to take a look at them when you have time. But let's go ahead and now jump into searching or using this tool to search for home visiting programs. So as I mentioned, family and healthcare and service providers can use this tool. And the way that you're going to go ahead and start your search is by selecting whether or not, or identifying whether or not you are referring somebody. So this is typically where our healthcare and service providers would be selecting this option here in the yellow button. Or if you're somebody who's looking for services for yourself, you would go ahead and select the I'm looking for free services for myself. I'm going to go ahead and start off with that example. So we'll select this blue button here. I'm looking for free services for myself. That'll take us to our first question that we're being asked to answer. And that's, asking whether we're pregnant, parenting, or pregnant and parenting. So let's break this down a little bit more. If you're a first-time parent and you're pregnant or you're expecting, and this is your first pregnancy that you're expecting, you would go ahead and select pregnant. Now, say you already have other children and you are also expecting. In that case, you would want to select the pregnant and parenting option. Or maybe you're past the pregnancy stage and now you're parenting. So in that case, you would just go ahead and select the parenting option. For today's example here, I'm going to go ahead and select pregnant and parenting. And then I'm going to be prompted to answer a series of questions. All of these questions are required to get you to the results page. And the reason that they're all required is really because the system is trying to take all of the information that it needs to identify whether or not somebody is eligible for one or more of the home visiting programs within the system. As Connie mentioned, this system is live, and so it's ever evolving. It's always moving, and we're always making changes to it based on the changes to funding sources or the changes to eligibility requirements. So the questions that are asked, you may come on 1 month and see a series of questions, and then a few months later come on and you'll see that the questions are slightly different, or there's one that's no longer asking something, and that's just because that question is no longer required. We won't ever ask a question that we don't need to be able to identify whether or not somebody is eligible for a program. And then before I move forward, I think it's also important to note that although these questions are being asked, none of these questions or your responses to these questions are saved or shared with anybody. So these are all questions that are being asked and used to filter to the list of eligible or programs that somebody would be eligible for, but they're not saved and they're not shared. So let's go ahead and move through these questions. So the first question asks if I'm less than 28 weeks pregnant. I'm going to say no, I'm not less than 28 weeks pregnant. And I'm being asked if I'm going to be delivering at one of the hospitals in this drop-down menu. LABBN, LA Best Babies Network, is actually based at California Hospital Medical Center. So I'm going to go ahead and select that option. We'll hit next. And now I'm being asked a series of questions related to CalWORKs and CalLearn. Have I applied for CalWORKs or CalLearn in the past 30 days? I'm going to say no. Because I haven't applied, this is not an applicable question, so I'll click NA. Are you or the child currently receiving cash aid or cash assistance benefits from CalWORKs or CalLearn or participating GAIN? I'm going to say no to that as well. I'll hit next. And now I'm being asked to answer or select circumstances from this list here that may apply to me. Again, this is just a reminder here. We have a note that shares this information is not shared or saved. It really is just to help filter through the programs and whether or not someone would be eligible. So some of the things that you could check off would be if somebody, or like if I myself was a teen, 19 years old or younger, maybe I've had maternal or paternal depression, anxiety, or other mental health challenges now, currently, or in the past. Maybe I don't have a support system, or maybe I'm older than 35 or 35 years old or older. I'm going to go ahead and select that option and also select that I'm pregnant with twins, triplet, or more for this example. Now, you may see that there are all of these questions, and somebody may come across or get to this page and say, none of these apply to me. In that case, all you would do is select none of these. Or if you prefer not to answer this question, that is also an option, and you would just select the prefer not to answer to be able to move to the next set of questions. So for this example, again, I'm just going to select that I'm a birth parent who is 35 years of age or older, and then I'm pregnant with twins, triplets, or more. I'll hit next. And now I'm being asked information about where I live, right? So since programs have specific service areas, and that's why this question is being asked, just to see if you're within the region in LA County that a specific program would be providing services for. So again, since LA Best Babies Network is based at California Hospital, I'm going to go ahead and select that as our address. And then I'll hit next. But before I do, there's also the option to select no permanent residence if that's the case. We'll hit next. And this next question is asking about income. So here I'll say that we're a household of 2 and our monthly income is $3,500. I'll hit next. And now I've answered all the questions that the system needs to be able to generate a list of results. And so that's what it's doing here. It's using all that information to sort all of that out. And at the end, these are the home visiting programs that, based off of the way that I've responded to the questions, the system says that I may be eligible for. It's the Welcome Baby program at California Hospital Medical Center, the Nurse Family Partnership program that's offered at the location being the Superior Court Building, or the Raising Baby program. So these are the 3 that I may potentially be eligible for. And then I would go ahead and see the contact information for each and then information on how to enroll. I'm gonna not spend too much time on this here, and I'll just go to another example just because in a few minutes, I know I have the ability to go ahead and expand on that a little bit more. So let me go ahead and jump back actually to my PowerPoint. Please bear with me here. So as I mentioned, I was going to go ahead and share another example here. Let's say that we've ran through that example, and these are the results for that second example. I ran through it, and here's the list of programs that my client, in this case, I selected the option to be a provider that was referring somebody. These are the programs that they may be eligible for. So let's make sense of this. What does all of this mean? How do I interpret it? Well, all of our results will be listed into categories. So this goldish category that just showed up on your screen is the home visiting program. So here's where you're going to see all the home visiting programs. As I mentioned, we also have doula services that are listed in the eDirectory. And if somebody is eligible for those, they're going to show up in this this section here. The heading for that section is going to be a purple color, as you can see here on the screen. And then the home visiting program models will have the headings listed in light blue. So that's how you'll be able to distinguish between the two. And we try and make it easy for you to be able to distinguish between a home visiting program and a doula program. And the reason is because people are eligible to participate in one home visiting program model and also one doula program. You can't go ahead necessarily and enroll in multiple home visiting programs. There's often dual enrollment restrictions, which limit the ability to enroll in more than one home visiting program, but you can enroll in one home visiting program and one doula program. So say that you get to the screen, and again, just going to go ahead and share how to interpret this. Again, the light blue indicates the home visiting program model. And here in the screen section that popped up are the agencies providing services using the home visiting model that's listed up above. So in this example, we have Children's Institute, their Wilmington location is the one providing the Early Head Start home visiting program. And then the Torrance Health Center, they have the Nurse Family Partnership program that this specific person that we did the search for would be able to enroll in. So when you're in terms of how to connect with these services, once you've understood the results and you know how to interpret that, you say, okay, well, in this case, I'm going to go ahead and select the Early Head Start program at Children's Institute. How do I enroll? What's the next step? In this case, the system is telling you you'll need to call them to enroll. So that at that point, you would just see the telephone number that's on the screen, make the call and let them know that you're interested in enrolling in their Early Head Start program. And that'll be the first step to beginning the enrollment process. But say that's not the case and you choose the Nurse Family Partnership program. In that case, you're going to go ahead and select the sign up now. There, you're going to get prompted to complete this referral form. And as Steve mentioned, in this, oftentimes the referral forms will be different. So this is a referral form specifically, in this case, for the Nurse Family Partnership Program. But if you were to enroll in another program, for example, Welcome Baby, and you were to select the Sign Up Now button for that program, the referral form would look slightly different for that. And that's just because all of the programs have their own referral forms or referral process that you would need to follow to be able to make that connection. So I know that was very quick, but I'll just quickly go over to some of our commonly asked questions. Some of the questions that we get are, who should I contact if I have questions about a referral? And those questions should be going to the home visiting agency you are sending the referral to. So not to the eDirectory administrators. They won't be able to help with this. Another question, I won't read through all of these, but another question again is, can I or the person I'm referring participate in a home visiting program and a doula program at the same time? As I just shared in a few slides back, yes, home visiting clients can participate in a home visiting program and a doula program. For time's sake, I'm going to go ahead and just let you all know that down here at the bottom, we have a link that you'll be able to click once you receive the slides for this presentation to be able to get to our frequently asked questions and get answers to some of those, like I said, commonly asked questions that we received. We're going to go ahead and skip past this example here. And then I'm going to go ahead and turn it over now to Steve to share briefly about our toolkit.
Great. Thank you so much, Amie. Yeah, nice job there. I hope, I mean, she got into some details and those slides kind of showed exactly how it works, but I think you just got to just take it for a spin yourself and you'll see that it really isn't very hard. It's not, there's not much to it. Just go through, answer those questions. As she said, you don't have to sign up for an account, create a password. None of the information is saved. It's really just to determine like what is out there for you or a family that you're interested in helping. And I wanted to mention too that I think the question in the chat about, you know, somebody having Kaiser, would she be eligible? Yeah, it's insurance really isn't a factor here. Healthcare insurance or delivery hospital. I know one screen there did ask which delivery hospital you're, if any of those you were delivering at, but if you're not delivering at any of those hospitals, it doesn't mean you're not eligible. It's just for the Welcome Baby program, really, which is hospital based. So just wanted to answer those two quick ones. And I, again, want to thank all those who shared with your staff or other teammates about this webinar. And our big ask now is if you could even just take one more step and share beyond that to the rest of the world using this toolkit, we would be forever grateful. There's a toolkit that we've created that has graphics you can share on social media. Some of the messages you can just copy and paste into your social media account. And if you work with an organization, you can share a little blurb that asks them to just put a little quick note about the eDirectory in that newsletter of your organization. We have flyers as well that you can distribute on this page. So it's all available on the LA County Consortium's website, which is homevisitingla.org/toolkit. If you go to the homevisitingla.org website, you'll see on the menu there's an eDirectory option there, so you can find it through there as well. Yeah, those are the flyers there on the right. And